My name is Sandeep Jalli. I'm an interventional cardiologist at Prisma Health. I was born in Augusta, actually, so I'm semi-local. I did undergraduate at Cornell University, and then I've sort of moved all over since then. I was a medical student in Atlanta, did my residency in Athens. I did a general cardiology fellowship in Oregon, an interventional cardiology fellowship in Florida, and then a complex coronary fellowship in Minneapolis. An interventional cardiologist treats coronary artery disease, specifically blocked and occluded coronary arteries with balloons, stents. We also do structural procedures and peripheral vascular procedures to treat diseases of those arteries and valves as well. I did a whole year of advanced training in Minneapolis at the Minneapolis Heart Institute in complex coronary disease and chronic total occlusions. And chronic total occlusions obviously is a little bit self-explanatory. It's 100% blocked coronary arteries. There's a limited number of people across the country that are trained to deal with that condition, and I am one of those people. I wanted to go into interventional cardiology because my undergraduate background is actually in engineering, so it sort of plays a little bit into the engineering, algorithmic, also work with your hands aspect of it. And I also really like helping people, and there's nothing more satisfying for a cardiologist than having a patient come in with a heart attack and being able to help them and knowing that you've changed the course of that person's life. Especially with the advanced training I've done, those patients are often told that they have no options and there's nothing that can be done for them, and they're sort of relegated to suffer. So I really wanted to be able to provide options for those people, especially in the area that I grew up in. I really like talking to people to make sure that they understand in simple words the conditions that they have, because what I found is that when the patient doesn't have an understanding, it's often when you end up with these gaps either in compliance with medications or coming to appointments. And when you help the patient take ownership of their medical conditions, I think you end up with much better results, and it makes everyone happier in the long term. It's actually interesting because I've only recently found that I have free time, but I love to travel. I obviously have family in the area, so we travel a lot. Love to read. I'm a big foodie, so I love to get out and explore and eat. Try and cook at home, but I'm not actually any good at that, so I'm mostly out and about eating. If you'd like to make an appointment with me, have your primary care provider make a referral.